Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
identification of the angles of the gonioscopy, angle structures of gonioscopy. So what are the structures which are present in the angles of the gonioscopy from anterior to posterior? From anterior to posterior, we have the following structures. Squall base line, direct meshwork is present with scleral spur, ciliary body and iris root are seen. So if you see the angle structures, so in the angle structure, so this is the angle. So if you see from anterior to posterior, the anterior most is squall base line, followed by non-pigmented trabecular meshwork, pigmented trabecular meshwork, scleral spur and ciliary body band, root of the iris. So ciliary squall base line, non-pigmented trabecular meshwork, pigmented trabecular meshwork, scleral spur, ciliary body and root of iris. So these are the structures which are seen in angle on the gonioscopy.
thank you and thank you for watching.